intercostal muscles, and I'm going to play my windshield wiper as I plow through the intercostal muscle area to where I'm comfortable, and then back up. Then you just keep pressure and you allow your elbow to go to the next rib. Then I scale directly on top of the next rib, all the way down to where I'm comfortable, back up, in between the ribs, down, back up, next rib, and then following all the way up to that last rib right along the inferior tip of the scapula. After I've done that from face to face and face to side, I will flip myself over as the practitioner, and I'm going to do everything from face to feet and face to side. So right on this side, I pulled everything down and out, and then when I go face to feet and face to side, I'm going to be pulling up and in. Pretty good? Scaling is still a scoop movement, but scaling just means there's not a lot of tissue depth. Like, you're not in between on the intercostal muscles face to side. You're working directly over top of bone, so I don't need to put a lot of pressure, and I'm just kind of scaling along the surface. Any other questions? Okay, so if we're good with that, I'm going to run through it really quickly, and then we're going to get her into fetal position. I'm going to continue along the ribs in fetal position, and then I'll just kind of show you the structure once again in supine position on the chest.
When we were face to face, face to side, start out with, and when we turn around and face to feet, face to side, on the other side of the person.
Yeah, I'm going to be over here reaching over.
So you can pull the direction.
Yeah, so as soon as I lift myself up and I go to this side, I will have to reach over her as I'm working. So you're only going to reach to as far as you are comfortable. You're going to get farther out when we get them into fetal position, and then it's just like right in the middle for you. All right, taking a little bit of that coconut oil, we are going to begin with a nice airplane landing effleurage massage. Try to make sure those hands are nice and warm. Beginning with that airplane landing technique, effleurage massage, just kind of kneading out the ribs, putting some pressure on. Coming up to that kidney area. It's around that erector spinae muscle of where we worked yesterday. Getting an understanding of the structure of her ribs. And then just going to do a little bit of that kidney sweep. So placing that forearm, and you're just sweeping with pressure back and forth to stimulate that area. After you've done it about 5 or 6 times, that's really all that's needed. So then you're going to begin with your elbow work at the base of the ribs from the first rib that you feel. And I'm going to work just about an inch out from the spine, just kind of off that erector spinae muscle of where I feel these ribs kind of like end where they're, or begin where they're attaching. And so now I'm going to vertically work all the way up to this inferior tip area, and then play my windshield wiper as far out as I possibly can. Generally, I'll probably get to about like here because I don't want to get uncomfortable. And like, yeah, I'm on my heels right now, but I'm like, I could be sitting on my buttocks, but I'm just leaning up against her. She's taking some of the weight off my body, so it's like very easy. And I'm allowing myself to use my upper body weight to just kind of rock, to do my 5, 6, 7, 8. Yeah, because I'm